You've been a professional vet for many years. On a scale of 1 to 10 of how painful this would be, what would we say, sir?
I would say right now, before checking deep inside the external ear,
Yeah. Wow.
with all that injuries made by himself, probably because of the discomfort and trying to stretch the area, somewhere around 7 from 10.
Wow.
But
Every day.
every day.
Every day. Wow. But young man, on the table, we're here to help you. He came in for behavioral modification, and I was able to introduce him to my clinical director, who immediately saw him. We didn't send the dog back home. Immediately, we made time to see this dog because we care.
We are sampling both ears. We'll take some swabs to have a double confirmation of the infection. We've already seen into his ears. We are expecting a positive result of Pseudomonas aeruginosa. It's a very nasty type of ear infection.
It's a chronic ear infection.
It's a chronic ear infection. That's the main pathogen agent which is inducing that type of chronic otitis. So let's sampling the ear, yeah.
It'll be interesting to see what this discharge looks like. And we've already cleaned it today. We cleaned it at the academy today. That's incredible.
Break it. So this is we're marking the sample of coming from the right ear. So as I've told you at the phone, we've did bloods, which came back perfectly normal. We've did X-rays, mainly without any issues. We just, as I've told you, a little amendment regarding his right hip, but that will be shown in terms of symptoms probably when he's getting older. Anyway, because of his breed, my advice is to start giving him joint supplements already. Yeah. Any of that supplements which are containing chondroitin sulfate, glucosamine, hyaluronic acid, and omega-3 oil. Also, we went into the dental room, and we had that surprise. One of the teeth was wobbly, the other one was damaged, and it was impossible to be safe. We removed both teeth, and right now he is perfectly fine. That issue with the teeth was a pain reservoir for him.
Huge pain reservoir.
Yes,
Yeah.
and this can change their behavior, becoming a bit more unsettled, becoming potentially aggressive, just because we can't understand them exactly.
Yeah, no, it's been very sad like that.
Yeah.
And now I know why.
Very sad. I mean, what I'd say most, sir, is that, you came to us initially for behavioral modification. And I'm a student of behavioral modification. And you met me for the first time. We're not cheap. And we gave you some advice. A lot of people can be very resistant, and you were open to it. When we've costed up what we've just done for you, it was £1,700. And we did that for £500 because, first of all, I was very sure, looking at that dog, something was not quite right.
Yeah.
My team at the academy wiped the ears. And, we have innocent members of the public like yourself that have gone to vets, right? And it wasn't taken seriously. I suffered myself with this. And then all of a sudden we've got animals that are not happy, that are reactive, become more aggressive, become withdrawn, and we're going from trainer to trainer. But the root cause actually could be, yes, the dog might not be obedient, but the behavioral issues is based on chronic pain without the ability to communicate. And that's what we do. That's why we do what we do now, to make sure that we get the veterinary side and the behavioral modification side married together. So the outcome for the dog is as perfect as it can be. I can tell you now, looking at the ears of that dog, how concerned were you?
So the ears being chronic in chronic condition is hard to say how much we can recover. But being another pain reservoir there, with an appropriate treatment which will keep this condition under control, we'll need to control his ears from time to time. We'll need to control his mouth from time to time as well. That's very important. First of all, let's rule out any kind of medical issues, and afterwards to blame the behavior and the dog itself. Alright, so because of the mouth anatomy, which is a brachycephalic type of skull, we can see how easily is to build and to develop tartar. He's just 4. We've got tartar in here, and also how easily is to have dirt under the gum, which will provoke halitosis, which means a smelly breath, because all that residual hair start rotten in here.
Just harbouring bacteria, isn't it?
See?
So again, when we have been linking behavioral issues with underlying chronic problems. So this dog has his ears absolutely terrible. Now look at this. Holy smoke.
You can see the
Oh
probe
my
to the other
goodness.
side, yeah? So this is a pain
Wow.
reservoir for
This
the
is a
dog.
10 out of 10.
Absolutely.
This is a 10 out of 10.
Look, this premolar has to be removed
Sure.
today.
Sure.
Okay. But the rest of his left side of the mouth is okay. So it's minimal invasive. Won't gonna affect his feeding and anything else.
So you're just extracting this now.
Yes, has to be done.
Has to come out.
Yeah. Because the alveolar ligament was very loose. Probably it was affected by the other tooth issues. Developed an infection which spread it to the next one.
Doctor, we have a duty of care to the Behavioral Modification Society now to talk about these health tests before these animals are put through unnecessary processes.
Look,
Wow.
this is hair,
Wow.
which was on the medial side. She's lubricating the eyes because during the anesthetic the membranes can become too dry, and eyes are very important because if are becoming too dry, it's potentially giving them some keratitis, and lubing the eye will prevent this. Okay, let's go to X-rays now.
I am very certain that chronic pain will cause animals to change their behaviors in a negative way. They will become snappy and very reactive.
So we've got the lumbar spine with the lumbar vertebrae here, part of the pelvis, and both femoral heads, those curved lines. But this is not an image to assess the hips. This is just to be sure we took all the lumbar spine into our image, to have a bit of the femoral heads and a bit from the cage rib. Yeah, that means we'll have all the lumbar spine into the picture. it's a normal picture. I have no worries about anything. The intervertebral spaces are very symmetric. We've got a very nice line underneath and also on top.
So we're now having a cradle that allows us to be able to take a better image of what area, Doctor?
Same area but a different view.
Different view.
It's a ventrodorsal picture of his lumbar spine. You can see the alignment.
Beautiful.
Which
Beautiful.
is perfect.
Beautiful.
Because he's a big dog and it's very hard to align the femoris perfectly. For my taste, if this one was a bit closer to the mid-axe, it was better, like this one. Yeah, this one is just a little bit, but it's still got a
The remarkable thing,
diagnosis.
but the
Okay.
remarkable thing is this. I mean, for a Mastiff, looking at these X-rays,
The symmetry in this picture is perfect. As you can see, the acetabularis cavities are okay, femoral heads are okay. Also, another way to evaluate the X-ray is how much from the hip bone is covered by the femoris, and you can see
the symmetry is wonderful.
symmetry in there, yeah, as well. As everybody can realize, it's an entire male.
Yeah.
Yeah, we have got the
Okay, so what particular image is this? This is for the
left knee.
left knee. Okay, and this is where the cruciate would normally be.
Yeah.
Okay,
So
all right.
we have 90-degree angle in here, which is okay. We can't see any kind of changes. We can't see any kind of joint effusion as well.
That's
so
really good
basically
news.
it's looking as a normal joint. Yeah.
That's
So
wonderful
the
news.
mid-axe from the distal femoris is getting straight in the area of tibial tuberosity, where
That's wonderful.
the ligaments.
And that's, Doctor, you know, you've been around a long time. The X-ray that we're seeing of this, the sort of physical anatomy of this dog, for a Mastiff is it's quite pleasing.
Yes, absolutely, because it's a very well known that that breed is coming with genetic issues, with not quite good congruity in between hips and femoris, and especially femoral head. Also with loose cruciate structure, which leading most of the times to cruciate ligament pathology as well. But with this one, I'm very pleased with the images at the moment.
Wonderful news.
Yeah.
He's a good boy, Rob. Good boy.
So we are just about to place an IV cannula into the cephalic frame of Apollo, just as a precautionary measure, and also so we've got IV access at all times throughout his sedation and his anaesthetic, or any medication or even IV fluids that he may need as well. He's a very, very good boy.
He's a good boy, but he's very heavy. Good boy.
Well done,
Good
Apollo.
boy. Good boy.
Under sedation, we can check his ears, check his anatomy, look at the blood, and make sure that we can rule out any health concerns that could be affecting his behaviour.
Softy. Oh, you're lifting it up for him. You're a clever boy. I'm just going to create and order some in-house bloods for Apollo, which we're going to run in-house. So we're going to select in-house. We're going to do a pre-anaesthetic test. So it's Chem 10. Plus we're going to do haematology. So I'll select that, review the order. I'm going to assign it to the vet. I'm going to order that test. Now if we go to the vet lab station, that should pop up on the
Perfect.
screen.
Brilliant. Right, so what are we doing here then?
So as I've just requested the test from the patient records, it's actually appeared on our lab station.
Perfect.
So all we need to do is click on his name, select the test that we're going to be running, we'll add it to the run, and that's now ready for me to prepare the sample.
Fantastic. And how long will that take until we have the results?
The biochemistry will take about 8 minutes.
Wow, really fast.
Yeah, and the haematology should take no longer than 3 to 4 minutes.
Fantastic.
So,
Brilliant
we'll
stuff.
have results soon.
Fantastic.
What was really important for me in this project was to be able to give people really in-depth advice, to be able to have a facility that was also incredibly well equipped, so that we can give people information as quickly as possible, and also have information available that helps us help a dog as soon as possible. So, let's see the expression on his face. Yeah. Look at the expression in his. Look at the. How are you feeling, sir?
I'm very grateful, very happy, and yeah.
Can you see his tail?
Yeah.
When you were with me at the academy, there was very little tail wagging. Yeah.
Thank you so much for all your team.
Yeah. You see his tail wagging? Yeah. The expression in his face. If you were to say anything about your experience so far today, what would you say, sir?
I'm speechless. I wouldn't go anywhere else ever again now with my dog.
God-
That's my dog.
God bless you.
So thank you so much.
God bless you. I can't tell you how proud, and actually it's quite emotional, to be honest with you, when I watch this back, and to be able to have helped this animal. I can't really describe the feeling, actually. I can't really describe the feeling. I'm grateful to God, I'm grateful to my team that we're able to do something incredibly special. These health MOTs are so important. And we are here to support you with the training, as we've always done for decades. But now my team at Noah's Ark are here to support the health profile of your dogs. You know, to make sure that we can predict and pick things up early so they don't suffer in silence. Godspeed. We look forward to supporting you and your dog anytime, any day. Contact us when you're ready. Please feel free to call the Noah's Ark team for any type of support that you might need. We have a state-of-the-art facility set in 55 acres. We also have paddocks that clients can use for running their dogs. And due to our historic ability to handle the more powerful working dogs, we specialize in that aspect.